Hey, just published an ebook on Amazon that is updated an advanced edition of the Memorizing Pharmacology, a Relaxed Approach book. And I put it out to ACX for people to audition for the script. So I thought it would be cool to read the script myself so that we can get all the pronunciations out there, and also to let you get a little glimpse of what's inside. I know that sometimes you like to hear the book before you think about getting it or seeing if it's useful for you. So what I'm going to read is first introduction, kind of talking about why you would need the book in the first place, and then just give you an example of what one of the slides looked like. Now, when you're changing something from an ebook to audio, there are some big changes that you're going to make, and you'll see them. And so what's in the actual book is at the bottom and not to be read because you have to show the narrator how you want to read it in a certain way. But anyway, this is me reading my own book, but I'm looking to try to get somebody else to do it. Memorizing Pharmacology Mnemonics, Audition script. Memory glue. Have you read a pharmacology chapter only to forget it a minute later? If you're busy with work, other classes, or like me with 6-year-old triplet daughters, you don't have time for constant rereading. To keep from forgetting, you need memory glue. Vibrant mnemonics that stick quickly and easily. This book shrinks the work to remember over 1,000 pieces of the most important information, medication names, classifications, side effects, and mechanism of action, to just over 100 slides. How do you know if you need this book? Well, apart from your grade in pharmacology class, it's tough to know how much pharmacology you know. However, we can do a quick and dirty back of the envelope test to see if this book is for you. If you're listening on your commute, name as many drug names as you can out loud. Number them as 1, aspirin, 2, ibuprofen, until you reach a number where you can't name any more. If you're at a desk, write out a list of numbered drug names. What you'll find is that at first, you'll quickly write out many drugs. Nevertheless, like popcorn that stops popping when only a few kernels remain, your ability to write drug names slows. That's a dangerous place to be if you need to answer questions immediately, as you will with the board exams like the NCLEX, NAPLEX, or USMLE. Most board exams won't let you go to prior questions. And what happens if you fail the boards? A Greek tragedy. Student gets hundreds of likes, loves, and congratulations on that cap and gown family picture post. Only months later, we see and hear nothing. They failed their board exam. That job or residency they had lined up? Gone because of a "you need a license in 90 days after graduation" clause. So let's make sure that story isn't yours. Instead, let's look closely at that drug name list. Did you group drug names? For example, if you wrote aspirin, did you write other analgesics like ibuprofen and acetaminophen? If you remembered penicillin, did you write another antibiotic, amoxicillin, or think of the related infection, methicillin-resistant Staph aureus? Each group represents a short story your brain built. In this book, we intentionally built solid, memorable stories into a single flashcard slide. There are 3 flashcard slide types. Either 1 contains only medication names, 2 contains only side effects, interactions, and mechanisms of action, or 3, it contains both. To provide contrast, I bolded medication names and italicized side effects, interactions, and mechanisms of action. Since you can't see that in an audiobook, when reading slides, I read bold medication names first, then italicized details second. Now this is another page in the book, but it's way into the book in the 4th chapter in the immune chapter. But it gives you an idea of the change that you have to make when you're going from print to audio. It's just not quite the same. 9. Fluoroquinolone antibiotics. Medical. MEDICAL. Drug names. M. Moxifloxacin, brand Avalox. D. Delafloxacin, brand Baxdela. C. Ciprofloxacin, brand Cipro. L. Levofloxacin, brand Levaquin. Side effects and interactions. E. Extra careful with sunlight. There's a risk of phototoxicity. I. Interacts with cationic multivalent antacids through chelation. A. Achilles tendon pain and rupture is a concern. Fluoroquinolone antibiotics. Medical. MEDICAL. Just below that is what it actually looks like in the book, and that whole italics thing, I'm just needing to provide some kind of contrast. I'll probably take the italics out just because it's a lot tougher to read italics than it is regular print, but there'll be contrast. And if you look at it, you can see, oh, let me look at the drugs first. Those are bold, and it makes it easy to look: moxifloxacin, delafloxacin, ciprofloxacin, levofloxacin. And then let me look at the other things I need to know. All right, well, I need to know the interactions. Sunlight, chelation, Achilles tendon pain and rupture, and that helps you remember it with the entire mnemonic medical. But let's get back to the reading, a quick summary. Fluoroquinolone antibiotics inhibit DNA topoisomerase and DNA gyrase, preventing DNA coiling, causing DNA to break. Broad-spectrum fluoroquinolones coverage includes gram-positive, gram-negative, and atypical bugs. You can administer PO or IV. Other QTC prolonging drugs increased patients' risk for QT prolongation and cardiac issues. Fluoroquinolones cause Clostridium difficile, but let's expand on our medical mnemonic. M, moxifloxacin, has the best coverage against strep pneumo and is for pneumonia, but not UTIs, as it does not reach adequate concentrations in the urine. E, extra careful with sunlight. Patients have a phototoxicity risk. D, delafloxacin meglumine, is good for acute bacterial skin and skin structure infections, ABSSSI, such as cellulitis or wound infections. That it has MRSA coverage and Pseudomonas aeruginosa makes it the first fluoroquinolone to do this. So in comparing vancomycin and acetrionam, it's found to be non-inferior. However, it's more limited in its coverage than levofloxacin. I, interact with cations, chelation to multivalent cations like calcium, magnesium, aluminum, and iron. So don't take with antacids, multivitamins, or other medications, or food containing these cations. C, ciprofloxacin has the greatest gram-negative and pseudomonal activity. A, Achilles tendonitis, black box warning for Achilles rupture, especially in older patients and those also taking steroids. L, levofloxacin and ciprofloxacin have renal dose adjustments, but moxifloxacin does not. To review, moxifloxacin has the greatest gram-positive coverage, ciprofloxacin has the greatest gram-negative coverage, and levofloxacin only gram-negative coverage. Select individual mnemonics. The quinolone stem is oxacin, O-X-A-C-I-N, but fluoroquinolones have the FL substem also. One student remembered quinolones are for UTIs because Dr. Quinn, medicine woman, a 90s television doctor, is female, and women get proportionally more UTIs than men do. Vigamox is an ophthalmic preparation of moxifloxacin that contains the VI for vision, and the generic name has the same floxacin stem. The brand name is different than moxifloxacin's oral form, Avalox. By cutting the floxacin stem from the generic ciprofloxacin, the manufacturer made the brand name Cipro. Levofloxacin is the left-handed levoisomer of ofloxacin, another fluoroquinolone. The brand name combines the lev from levofloxacin and quin from fluoroquinolone to form Levaquin, or you'll hear Levaquin. Like fluoroquinolones, the next slide consists of medications covering gram-negative bacteria. Anyway, that's a look inside to the new book. It has 375 pages, so there's about 150 of these mnemonic cards, or flashcards if you want to call them that. And I certainly welcome your feedback. Let me know what you think in the comments below.